stop ignoring your hands. Right now, look down at them. Open them. Close them. Look at the skin, the knuckles, the color underneath your fingernails. If you are over 60 and living with diabetes, or if diabetes runs in your family, your hands are trying to tell you something your blood sugar meter cannot. Most people glance at their hands 100 times a day and never see what is actually happening on the surface. They think their hands are just getting older. They think the stiffness is arthritis. They think the dryness is the weather. They think the tingling is from sleeping on them wrong. But here is what nobody tells you. Long before your A1C climbs into dangerous territory, long before your doctor changes your medication, long before a wound refuses to heal, your hands begin to whisper. And those whispers are warnings. Stay with this, because by the end you will know exactly which signs to look for, in what order they appear, and what to do the moment you spot them. There is one sign in particular, the one most missed, the one most dangerous, and that one is being saved for the end. Before going any further, a quick word about who is speaking. The narrator behind this channel spent years studying the slow, quiet ways the body breaks down under high blood sugar, and the slow, quiet ways it heals when given the right support. This is not medical advice. This is education, drawn from published research and the lived experience of thousands of older adults who learned to read their own bodies before a crisis taught them the hard way. And the truth is, the person writing these words is not immune. A close family member, a grandfather, lost 2 toes to diabetes that nobody caught early enough. His hands had been telling the story for years. Nobody knew how to listen. That is the reason this exists. So that you, watching right now, never have to learn this lesson the way he did. Here is the reframe that changes everything. You think diabetes is a blood sugar problem. You have been told for decades to watch the numbers, count the carbs, take the pill, check the meter, and those things matter. But after 60, diabetes is not really a sugar problem anymore. It is a circulation problem. It is a nerve problem. It is a small vessel problem. The sugar is the spark, but the fire burns in the tiniest blood vessels in your body, the ones that feed your fingertips, your toes, your eyes, your kidneys. That is why your hands matter so much. Your hands are the easiest place in the entire body to see what those small vessels are doing. They are the window. The meter on your kitchen counter tells you what your blood sugar was 5 minutes ago. Your hands tell you what diabetes has been doing for the last 5 years. That is why people who only watch the numbers get blindsided. They were watching the wrong dashboard. The hands were lit up the whole time. Now for the stakes, and this part is hard, but it has to be said. Diabetes is the leading cause of non-traumatic amputation in older adults. Roughly 1 in 4 people with diabetes will develop a foot or hand complication serious enough to require medical intervention. And here's the number that stops people cold. Once an older adult has a major diabetic amputation, the 5-year survival rate is worse than many cancers. Worse than breast cancer. Worse than prostate cancer. Read that again. The complications of poorly managed diabetes are not just inconvenient. They are life-shortening. They steal independence. They take the grandfather off the porch and put him in a wheelchair. They take the grandmother out of her kitchen and put her in a care facility. Nobody talks about it this bluntly because it is frightening. But there is a reason to keep watching, and the reason is this. Almost every one of these outcomes was preceded by warning signs that showed up in the hands months or years earlier. Catch them, and the story changes. Miss them, and the story writes itself. So here is what is coming. 7 warning signs in your hands that diabetes is getting worse. They will be ranked from the most common, the ones nearly everyone misses, all the way up to number 1. The sign that less than 3% of people recognize, but that doctors quietly consider the most predictive of serious complications down the road. Number 1 is the one to remember. Number 1 is the one to write down. But to understand why number 1 matters, the other 6 have to come first. Before going into number 7, a small ask. If this video is already useful, leave a comment with your age and how many years you have been living with diabetes or pre-diabetes. Not a paragraph, just the numbers. That information helps more people find this and helps the channel learn who is watching. Number 7, dry cracked skin on the back of the hands that will not heal no matter how much lotion is applied. Most people blame the weather. Most people blame soap. Most people blame age. And those things do play a small part. But in a person with rising blood sugar, the deeper cause is something called autonomic neuropathy. The tiny nerves that tell your sweat glands when to release moisture begin to misfire. Your hands stop sweating the way they should. The skin loses its natural barrier. Think of it like this. Imagine a garden that used to have an automatic sprinkler system on a timer. The timer breaks. The sprinklers stop turning on. The lawn goes brown. The soil cracks. That is what is happening to the skin on your hands. The sprinklers inside the skin have been switched off by sugar damage to the nerves that control them. Research published in diabetes care journals has shown that up to 40% of older adults with type 2 diabetes develop measurable changes in sweat function in the hands and feet, often years before any other neuropathy symptom appears. 40%, and almost none of them know it. There was a woman, 72 years old, a retired school teacher from Ohio, who had been slathering on the most expensive hand cream she could find for nearly 3 years. Her daughter kept buying her new jars. Nothing worked. The cracks at the base of her thumb would split and bleed every winter. When her endocrinologist finally connected the dots, her A1C had climbed from 7.1 to 9.3 over those same 3 years. The hands had been screaming. Nobody had been listening. Here is what to do. Switch from lotion to an ointment containing ceramides or petrolatum, applied to damp skin within 3 minutes of washing, twice a day, morning and night, and book a check of your A1C if it has been more than 6 months. The lotion alone will never be enough because the problem is not on the surface. The problem is underneath. And that brings up a deeper issue because the next sign is about what is happening underneath the skin, not on top of it. Number 6, stiffness in the fingers, especially in the morning, that feels like the joints have been glued shut overnight. This is not arthritis, although it is constantly mistaken for it. This is a condition called diabetic cheroarthropathy, sometimes called diabetic hand syndrome. And it is one of the most reliable physical signs that blood sugar has been elevated for a long time. The mechanism is this. High glucose in the bloodstream begins to cross-link with the collagen in the tendons and skin of your hands. The collagen becomes stiff, leathery, less flexible. Imagine a leather belt that has been left out in the sun for years. It used to bend easily. Now it cracks when you try to fold it. That is your finger tendons under chronic high blood sugar. A simple test that researchers use is called the prayer sign. Press the palms of both hands together, fingers pointing up as if praying. In a healthy hand, the palms and fingers lie completely flat against each other. In a hand affected by diabetic stiffening, a visible gap appears between the fingers or the palms cannot fully meet. Studies have found that a positive prayer sign in an older adult with diabetes is associated with a significantly higher risk of microvascular complications in the eyes and kidneys within the following decade. The hands, again, predicting what the rest of the body is about to do. A man, 68, a retired carpenter from Michigan, noticed he could no longer wrap his hand fully around a hammer handle. He thought he was just losing strength. His granddaughter, a nurse, asked him to do the prayer test at the kitchen table. His fingers would not touch. 3 months later, an eye exam revealed early diabetic retinopathy. The hands had warned him first. Here is what to do. Do the prayer test once a week. If a gap appears, do not panic, but do book an appointment. Gentle daily stretching, opening and closing the hands slowly 20 times in warm water, can help maintain flexibility. And tightening blood sugar control can sometimes partially reverse the stiffness. But stiffness is only one way the hands speak. The next sign is louder, and most people feel it long before they ever see it. Number 5, tingling, burning, or a pins and needles sensation in the fingertips, especially at night. This is peripheral neuropathy. And when it shows up in the hands, it is often a sign that the disease has been advancing quietly in the feet for longer than anyone realized. The mechanism is brutal in its simplicity. The longest nerves in the body are the ones that travel from the spine to the toes and from the spine to the fingertips. High blood sugar damages the protective coating around those nerves called myelin. Without myelin, the nerves fire incorrectly. They send pain signals when there is no pain. They go silent when there should be sensation. Think of myelin as the rubber insulation around an electrical wire. Strip it away, and the wire sparks at random and shorts out completely in places. That is what is happening inside your fingers when they tingle for no reason. The American Diabetes Association reports that up to half of all people with diabetes will develop some form of neuropathy, and in older adults the figure is even higher. The tragedy is that by the time the tingling is constant, significant nerve damage has already occurred. Early intervention can slow it. Late intervention can only manage it. A woman, 75, a retired bookkeeper from Arizona, woke up every night at 2 in the morning with her fingertips burning. She thought she was sleeping on her arm wrong. She bought new pillows. She tried different sleeping positions. Nothing helped. When she finally mentioned it to her doctor, her fasting glucose had been creeping up for 2 years. Tight blood sugar control, along with alpha-lipoic acid supplementation under medical guidance, brought significant relief within 4 months. Here is what to do. If tingling in the hands wakes you at night, write down how often, in which fingers, and for how long. Bring that log to your next appointment. Do not wait 6 months. Do not wait 3 months. Make the call this week. Now, if number 5 is about the nerves inside the hand, the next sign is about what you can actually see on the skin, and once it is pointed out, it becomes impossible to unsee. Number 4, dark, velvety patches of skin on the knuckles, the back of the hands, or in the webbing between the fingers. This condition has a name. It is called acanthosis nigricans, and it is one of the clearest visible signs of insulin resistance the body can produce. The mechanism is this. When your body is producing too much insulin to compensate for cells that have stopped listening, that excess insulin signals certain skin cells to multiply and darken. The skin in the affected areas thickens. It takes on a brownish or grayish tone. It feels softer than the skin around it, almost like velvet. People scrub at it. They think it is dirt. They try to wash it off. It does not come off because it is not on the skin. It is the skin. Research has shown that the presence of acanthosis nigricans in an adult is associated with significantly higher rates of insulin resistance and progression to overt type 2 diabetes. It is one of the few signs that is visible to the naked eye and almost diagnostic on its own. A man, 70, a retired mechanic from Texas, had dark patches on the backs of both hands for years. His wife thought it was sun damage. His barber thought it was age spots. His grandson, a medical student, recognized it instantly during a family dinner. His next blood test confirmed type 2 diabetes. He had been pre-diabetic for nearly a decade and never knew. Here is what to do. Look at the back of your hands in bright natural daylight. Compare them to the skin on your inner forearm. If there is a clear difference in color or texture, ask for a fasting glucose test and an A1C. The skin is showing what the blood is hiding. And while the skin is the focus, the next sign also lives on the surface, but it tells a story about what is happening deep inside the smallest blood vessels in your body. Stay with this, because what comes next surprised even seasoned clinicians when the research first came out. Halfway through, if this is the first explanation that has finally made sense of what your hands have been doing, hit the like button right now. It costs nothing, it takes a second, and it tells the algorithm to show this to more older adults who need to hear it. Do it now, because the next 3 signs are the most important of all. Number 3, slow healing cuts, scratches, and hangnails on the fingers. Everyone gets a paper cut. Everyone snags a hangnail. In a healthy older adult, those small injuries close up within a few days and disappear within a week. In a person with worsening diabetes, the same small injury can linger for 2 weeks, 3 weeks, a month. The skin around it stays red. The scab keeps cracking open. The healing never quite finishes. The mechanism here is circulation, and it is the heart of why diabetes is so dangerous in older adults. High blood sugar damages the lining of the smallest blood vessels, the capillaries that feed oxygen and immune cells to the skin. Without that supply line, the body cannot deliver the workers it needs to rebuild damaged tissue. Imagine a construction site at the end of a long, broken road. The materials cannot get through. The workers cannot get through. The building never finishes. That is your fingertip after a small cut, waiting for supplies that are stuck in traffic miles away. Studies on wound healing in diabetic patients have consistently shown that even minor wounds take significantly longer to close, and the risk of infection during that extended window is dramatically higher. A woman, 71, a retired florist from Oregon, sliced her thumb on a kitchen knife. A small cut, the kind anyone would dismiss. 3 weeks later, it was still weeping. She finally went to urgent care. The infection had spread under the nail bed. She nearly lost the thumb. Her A1C at that visit was 10.1. She had stopped checking it the year before. Here is what to do. Time every cut. If a small wound on the hand has not closed within 7 days, see a doctor. Not next month. Not next week. That week. Wash daily with mild soap, apply a thin layer of petroleum jelly, and cover with a clean bandage. And get the A1C checked. Slow healing is the body waving a red flag, and the flag deserves a response. Number 2, changes in the color of the fingertips or fingernails, particularly a pale, bluish, or grayish tint that does not go away when the hand is warm. This is one of the clearest signs that the circulation in the smallest vessels has begun to fail. The mechanism is the same capillary damage discussed earlier, but at a more advanced stage. When the tiny vessels in the fingertips become narrowed or damaged, oxygen-rich blood cannot reach the tissue. The skin loses its healthy pink tone. The nails lose their natural shine. Sometimes the nails become brittle, ridged, or develop a yellowish cast. Think of a houseplant that is being slowly cut off from water. The leaves lose their color first. Then they curl. Then they fall. The fingertips, given enough time without adequate circulation, follow a similar pattern. Except the consequences are far more serious. Research has linked changes in nail and fingertip appearance in older diabetics to a higher risk of peripheral artery disease, which in turn raises the risk of heart attack, stroke, and amputation. The hands again, predicting what is coming for the rest of the body. A man, 73, a retired truck driver from Tennessee, noticed his fingertips looked dusky in the morning. His wife thought he just had cold hands. His doctor, after a careful exam, ordered an ankle brachial index test, which measures circulation in the legs. The results showed significant peripheral artery disease. He started a treatment plan immediately. His wife told the doctor afterwards that she had been buying him fingerless gloves for 2 years to keep his hands warm. 2 years of warning, dismissed as cold hands. Here is what to do. Once a week, in good natural light, press a fingertip until it goes white, then release. In a healthy hand, the pink color returns in about 2 seconds. If it takes longer, or if the color comes back uneven, or if the fingertips look bluish even in a warm room, write it down and call the doctor. This is not a symptom to wait on. The vessels in the fingers are mirrors of the vessels in the heart and the legs. Now, the moment that has been coming since the start of this video, the number one warning sign, the one less than 3% of people recognize, the one that doctors quietly take more seriously than almost any other physical clue in the hands. Comment below with the words "I will watch" before this one is revealed, because what comes next is the sign worth remembering above all others. Number 1. A thickening of the skin on the palm of the hand, often accompanied by one or more fingers slowly, painlessly, beginning to bend toward the palm and refusing to straighten all the way. This condition is called Dupuytren's contracture, and while it can occur in people without diabetes, its rate is dramatically higher in older adults with long-standing or worsening diabetes. Research has shown that people with diabetes are several times more likely to develop Dupuytren's, and the severity tends to track with how long blood sugar has been poorly controlled. The mechanism is this. A layer of tissue called the palmar fascia, which lies just beneath the skin of the palm, begins to thicken and form cords. Those cords pull on the fingers, most often the ring finger and the little finger, drawing them slowly toward the palm. At first, it is just a small lump in the palm, then a thicker band, then a finger that will not lay flat on a table. Imagine the ropes of a sail slowly shrinking. The sail itself, the hand, gets pulled out of shape. There is nothing the person can do to force the finger straight because the problem is in the tissue underneath, not in the joint itself. Why does this matter so much? Because Dupuytren's contracture in a diabetic older adult is one of the strongest physical predictors of long-term complications elsewhere in the body. It is a sign that the cross-linking of sugar with the connective tissues, the same process happening in the eyes, the kidneys, and the heart, has been underway for years. The hand is the visible chapter of an invisible book. A woman, 74, a retired nurse from North Carolina, noticed a small lump in the palm of her left hand. She ignored it for a year. By the time she saw a hand specialist, her ring finger could no longer lie flat. Her endocrinologist ran a full workup and discovered early kidney changes that nobody had caught. She started aggressive blood sugar management, a referral to a nephrologist, and a course of treatment for the hand itself. 2 years later, her kidney function had stabilized, her finger had been treated, and she still drives herself to her grandchildren's school plays. She told her doctor that the lump in her palm probably saved her life. Here is what to do. Once a month, lay both hands flat on a table, palms down, fingers spread. If any finger refuses to lie completely flat, or if a hard lump or band can be felt in the palm, get evaluated. There are treatments, including injections and minor procedures, that can restore function if caught early. And if the diagnosis is confirmed, treat it as a signal to look at everything else: the eyes, the kidneys, the heart. The hand was the early warning. Use it. Now a hard truth. Why has none of this been explained before? Why does the average older adult with diabetes leave their 15-minute appointment with a new prescription and no education about any of these 7 signs? The answer is not that doctors do not care. Most doctors care deeply. The answer is that the system they work in does not give them time. A primary care visit in the United States now averages less than 18 minutes. In that window, the doctor has to review the chart, listen to symptoms, do an exam, refill medications, order tests, document everything, and somehow still talk to the human in front of them. There is no time to teach the prayer sign. There is no time to discuss acanthosis nigricans. There is no time to look carefully at the fingertips. The system is built for billing codes, not for the quiet, careful observation that catches diabetes before it takes a toe, a finger, an eye, a kidney. That is not the fault of any individual doctor. It is the design of the machine they work inside, which means the responsibility falls, more than it should, on the patient and the family. The good news is that the patient and the family, once educated, are actually better positioned than anyone to catch these signs early, because they see those hands every single day. So here is what to remember. 7 signs: dry, cracking skin that will not heal, stiffness that fails the prayer test, tingling and burning at night, dark velvety patches on the knuckles, cuts that take too long to close, pale or bluish fingertips, and the most important of all, thickening in the palm with fingers that no longer lie flat. Look at the hands once a week. Pick a day: Sunday morning with coffee, Saturday after breakfast, whichever day will actually happen. Spend 2 minutes. Open the hands, close the hands, press the palms together, lay them flat on the table. Look at the color, the skin, the nails. 2 minutes a week is all it takes to catch most of these signs early enough to change the story. Here is the challenge. For the next 30 days, do the 2-minute hand check every week. 4 checks. That is it. Write down anything that looks different from the week before. And if a doctor's appointment has been put off, make the call. Today, if possible. Tomorrow at the latest. There is no shame in walking in and saying, I learned to look at my hands, and I noticed something, and I wanted to be sure. That sentence may be the most important sentence ever spoken at a checkup. And here is the truth worth holding on to. Diabetes does not have to be the end of independence. It does not have to mean a lost toe, a lost finger, a lost driver's license, a lost garden, a lost porch. Many people live full, active, dignified lives well into their 80s and 90s with diabetes because they learned to listen to what their bodies were telling them. The hands are not the enemy. The hands are the messenger. And the messenger has been trying to help all along. Whoever is watching this right now is not broken, not declining, not done. Whoever is watching this is someone who refuses to let a disease quietly take what matters most. That is the kind of person who reads the signs early. That is the kind of person who walks into the doctor's office ready. That is the kind of person who is still here, still strong, still showing up for the grandchildren, the spouse, the friends, the morning coffee, the long life that is still ahead. Share this video with someone over 60 who matters. A spouse, a sibling, a friend from church, a neighbor. 2 minutes of their time today could mean 10 more years of their hands holding the people they love. Take care of the body. It is the only home anyone gets.